Hello, everyone. We are going to give folks a minute or two to join, and then we will get started. Thank you all for being here. Hello, hello. We'll give folks a minute or two to hop on, and then we will kick things off. All right, that was the big wave of everyone in the waiting room. So I'm going to go ahead and get started, and then we will let people in via the waiting room as we get going, but just to kind of really respect people's time. So first off, thank you so much, everyone, for being here. My name is Zach Sheehan. I am the executive director of the New Hampshire School Funding Fairness Project. We are delighted to be working with a bunch of great partner organizations again this election cycle to offer this webinar series. This is the third year we've helped run this, and this is our largest and most robust number of webinars. So this is the first one in this series. We'll be doing the next 5 weeks, Tuesdays at noon. Each week is going to have two different organizations, and we kind of tried to theme these based on the participants and their areas of expertise. So today we have New Futures and AARP. Very excited to have them kicking things off. A few little logistics, and then I'm going to kick it over to Judith from New Futures. We are recording these. The recordings will go up on the landing page on our website. All of you will be getting an email with that landing page. We had a lot of people submit a lot of really good questions ahead of this. So we've gotten those to Judith and Mike, and then I will also be moderating the chat to kind of get questions as they come up. So feel free to throw those in the chat. We'll try to answer as many as we can after they give their presentations. And then also, hopefully folks will be coming to some of the future ones and let us know, how this was helpful, what worked, what didn't. We want to keep providing this to folks, and it's totally open to the public. Anyone can attend these. So with that, I'm going to kick it over to Judith to get us started.
Hi, everybody. I'm so happy to be here and really appreciate the format and the platform. And what Mike and I decided to do is I'm going to hit some very broad topics, and then Mike will be doing a deeper dive into specific topics. So we've got a strategy, and I also bartered with Mike, maybe use a little bit of his time, depending on how I do with my timing. So let me start by sharing my slides. There we go. So, yep, I'm from New Futures, and happy to say that as of June 2024, New Futures does a lot of substantive areas, but what they did in 2024 is add the substantive area of healthy aging. So we've been up and running for about 2 years. So when we talk about healthy aging, what's important that we address is New Hampshire demographics. So individuals who've been following demographics and know a little bit about it, you probably have all this information. And if you don't have it, you're going to be hearing it over the coming years. And that is New Hampshire's an aging state, like many states, but New Hampshire is tied with Vermont as the second oldest state right after Maine. So what does that mean on the ground? From the 2023 census, what we have is adults over the age of 65, roughly 28% of the population. But when we get to 2050, what we're going to have is 1 in 4 folks will be older than the age of 65. The next graphic is pretty helpful because what that does is give you an idea. If we look at the bars that are bulging out, we're looking at folks 60 to 70. And then the group that's lower, we're looking at the younger years. So really what this means is over time, the needs of this older adult population as they age will change. So it's fluid. So it's keeping track of New Hampshire's aging, but where are the most individuals? What age group are most of the individuals? And how does that change the needs of policy? So wanted to start today looking a little bit at, how do we think about aging? And looking at some of the words we use around aging. And what we found is some of the words around aging have been maybe panicky. Oh, there's a silver tsunami coming. And so thought we'd start, even though the goal of today is looking at what obstacles older adults face in New Hampshire, just thought that it's really reasonable to have this discussion and look at demographics of aging as an opportunity. And what would that opportunity be? And we're looking at folks who can volunteer. New Hampshire has high volunteer rates among folks 65 plus. We have workforce contribution. And looking over the coming decade, it's this older group who may be driving workforce growth. And then, not to minimize economic benefit, this age group is consumers, taxpayers, caregivers, and volunteers, and really making community contributions. So really, in any discussion about aging, want to be sure we look at this also as an opportunity. And the next, really, as we're looking at aging, just give a minute to consider, how do we think, talk, and feel about aging? And because this has been the focus of my work for so many years, I've had to look at my own conceptions about aging, maybe my own aging stereotypes, and raises the question, do we have some ageism so that our thoughts about aging are so ingrained we don't even notice them? So what I wanted to do is list a resource, and this is the National Center to Reframe Aging. I've got a link for that. And what that organization can do is just lead you through some thoughts on maybe your own ageism or organizational ageism, but also provide tools. How do we be more neutral when we look at aging? And I share also some of my personal experience. When I was giving a presentation to folks who were case managers, and they were from other countries, and I was giving a presentation on public benefits, and I thought the questions I'll receive really have to do with public benefits and what benefits are available for older adults. But the first question out of the box from me, from someone from a foreign country, was, why is it that your culture, your country, doesn't respect elders? And wow, fortunately, I can think on my feet. I did think about it, and at the time, my answer was, I wonder if, as a culture, we're afraid of aging, and because we're afraid of aging, we want to put an age group aside and not think about it. So I just offer that personal experience and then this resource, and just invite all of us to think about, if we're bombarded with commercials on how to hide aging and tools to hide aging, what does that say about our culture? And just invite us, as we're looking at critical policy, are there some things underneath that just great to bring into the light? So just wanted to lead with those two items. So in our discussion about aging, what we like to do is frame this around age-friendly communities. And that's kind of the standard of what we want. And then when we look at problems, we look at the standard, how does this act as an age-friendly community? And this age-friendly community has been a term promoted by AARP and WHO. And it's really a community for all of us that supports us with housing, transportation, community needs, socialization, and inclusion. So have this lens as we look at what are the problems facing older adults. So as we look at the problems facing older adults, wanted to start with access to health care and really promote the system of care for healthy aging, which was legislation that was advanced in 2023. And this legislation really set the framework. New Hampshire has a system where it really was much easier to go in need to an institution or a nursing facility and not really strong, robust systems in place to help people age in place. And when we look at what individuals want, what do they want to do? They want to do is age in place. But in order to do that successfully, we need an infrastructure and we need services. So the system of care for healthy aging targeted reimbursement rates, targeted IT, data-informed services, and it is a comprehensive, multifaceted statute, which one piece of the statute I really appreciate, there's a lot of reporting in the statute. And what I've done is give you a link. DHS has a webpage where you can find out more about the statute, you can get access to all the reporting on the statute to date, and also all access to all the DHHS presentations through 2024. So a real resource and starting point when we talk about access to healthy aging healthcare services, and really New Hampshire not having a good balance or underlying pinnings to help folks thrive in the community. And it would not be fair when we look at healthcare not to mention the healthcare workforce. And we have some good groups examining the healthcare workforce, including Health Force New Hampshire. And we're looking at a state that really is facing potential shortfalls in the need. But to double that with the workforce, not only we're looking at increased need, but also thinking about we have some very skilled practitioners who will be aging out. And then you won't have retention for those skilled folks to remain in the workforce. As we look at the hard times or issues older adults are facing, any survey that's been done that looks at what are older adults saying? What do they say they need? What's lacking? The number one thing that comes up on all the surveys is transportation. And really proud to say, happy to say, that the New Hampshire Commission on Aging has really led the way and has this month on their webpage, you'll see a community transportation needs assessment on the affectionately called CTNA. And I can't stress enough how much this was needed and the vast array of data that this body of work is going to provide us. And what speaks to me from this is thinking about, this just struck me, that individuals will outlive their ability to drive by 10 to 15 years. So I just always bring that home to myself and look at what would I do right now in my home with a steep driveway, not walking distance to anything. What would I do if I couldn't drive? So the Commission on Aging loved their executive summary, which really says transportation is healthcare, and saying that do people want to work, they want to volunteer, but what do they do if they can't get there? Also, this body of work gives some suggestions for legislation. As we're looking at transportation, just to summarize a few, better Keep New Hampshire Moving website that gives links to rides. Links to rides, yes, there are a lot of holes in the system. Funding for mobility managers, and could there be a key person who works throughout the department to coordinate? So just some wonderful ideas from the New Hampshire Commission on Aging. And transportation is a key issue facing older adults. The next topic is financial security, and I can stress enough how much this has played into our testimony before lawmakers. So if there was a move to cut food stamps, if there was legislation about housing, we really wanted to come in strong and talk about this age group. So what we found is from New Hampshire Physical Policy Institute that poverty among 65 and older, this is the age group post-COVID where it's increasing. It's increasing nationwide. It's also increasing in New Hampshire. But also wanted to take a peek as we look at financial security. Let's take a deeper dive into Social Security retirement. And what we have is the average Social Security check is less than, it's a little bit over right now, $2,000. But want to give you a tool. And there's a tool called the Elder Index. And I've got this in the screen. I've also got resources at the end of the talk. You can go into this tool and click off a county and a state, and then give some factors. Are you in poor health, good health? Are you married, single? Do you rent or own? And what this will do is highlight what's the average cost of living to have a dignified life in New Hampshire. So this legislative testimony spoke volumes to lawmakers. And I think if you do what I did, I immediately got this tool. I immediately looked at what kind of jeopardy I was in my county. Like, will I have enough? So it's a real compelling tool. The other thing that this information gives us is Social Security. Thinking of a household, what often happens with older adults, when you have two people in the household, you may do okay. Think about what happens when one person dies. You go to if they're married, the highest Social Security check. What leaves that household is economic stability. What leaves that household may also be skill base. In a couple, maybe between the two of you, you have good driving, good bank skills, and physical ability. But when one person leaves that couple, you have financial insecurity, and maybe a skill set also left the household. So what we talk to in our listening sessions is a lot of folks in jeopardy when a partner dies. Besides the heartbreak, you have some financial instability. Next comes housing, and this would go into the whole realm of financial security. And sad to say that also in the area of housing, the group that has the most housing instability, the highest growing percentage of unhoused, is adults over age 55. And in New Hampshire, this statistic comes from the New Hampshire Coalition to End Homelessness, the report from 2025. So this is also a figure that is mirrored nationally. So what we see nationally, sometimes we don't see in New Hampshire. Unfortunately, for poverty rates and unhoused, we are seeing that in New Hampshire. And if we look at the slide and the numbers, what we see here is, well, why are we being unhoused? And we're looking at folks with fixed incomes, and often folks who want to work but may not be able to work. And in our listening sessions, we heard a lot from folks who wanted to work but who were not able to work. And what these two slides do is give you a look at renters using more than 30% of their income for housing, and also homeowners with property taxes using greater than 30% of their income for housing. Wanted to then switch focus, and let's look a little bit at solutions. And based on what we've seen for problems, looking at solutions, and really let's look back at the system of care for healthy aging, and let's look at that legislation. And for policies, are we supporting that statute? Are there still gaps in that statute? Has the funding remained in that statute? What have we done looking at the reports the department has made to keep up and follow the statute? It gave us the best framework to keep people in their homes and do it so there's actual choice to stay in your homes. So it's keeping this wonderful statutory system front and center and looking at that and analyzing how can we make sure there's real choice for folks who want to age at home. The next is let's focus on the areas that keep people at home. And I can give these broad examples of where we might need funding to help rebalance the system. And that includes what we've talked about: transportation, Another is adult day services, a really cost-effective way. If you're a caregiver, can that loved one go an adult day and get a full day of services at a lower rate? Caregiver support, community services in the home. So just a look at what do we need to bolster to make sure we keep up the momentum that we've had from the system of care for healthy aging. But then wanted to just go a little deeper with these next suggestions and let you see how some of these ideas could translate into legislation. So what New Futures had done for the last couple of years is support caregivers and support programs that use volunteers. So imagine legislation where you're saying to lawmakers, this long-term care system is expensive. They know that. Who's doing the bulk of the work? It is not the money going into the long-term care system. It's the caregivers. The caregivers, the man hours are billions of dollars. Does it make sense to support those caregivers so they have longevity? How can we support the caregivers? Is it respite? Is it adult day? Is it training? Let's look at existing programs that have an infrastructure, senior companions and RSVP, to leverage folks who are volunteering. In-home companions, transportation, let's do handyman services, let's get you groceries. So these are programs that exist. They get federal funds. There's an infrastructure. Do we have the bandwidth to just give some state dollars to these programs? Next, a little bit of a deep dive. We've talked about economic insecurity. And one program we've advanced in 2 legislative sessions, dollars are tight with limited success, is promoting a program, expanding it and promoting it, Medicare Savings Program. It's a Medicaid program, but it pays for the gaps in Medicare. And what a lot of folks may not appreciate, they think, well, you get on Medicare and you're all set. And the truth is you get on Medicare and you find out, wow, there are a lot of costs being on Medicare. And we look at folks who are in the lowest income bracket, can't afford basic needs. So expanding this program, what would it do? This program helps pay for the Medicare Part B premium. And right now, monthly, that's $200. So if that income limit and resource limit could be expanded, we literally would be putting $200 back in the pockets of folks most in need. Could that make sure they can cover rent that goes up? Would it make sure you can pay for a prescription drug? Can we use it to make sure that you have gas money or can pay for in-home care? So that little bit could go a long way. And the final solution just to consider, let's make sure New Hampshire is really leveraging all types of federal assistance programs. And we do get funding through Older Americans Act. And watching that legislation, what is U.S. Congress doing with that funds? It pays for programs on the ground level in the community. Are we making sure we maximize Medicare? So for example, on Medicare, if you're a fall risk, you can have PT for balance. Do seniors know that? You're unsteady on your feet, you can get PT for that. Medicare now pays for some caregiver training. Do people know about that? Medicare has a low-income drug subsidy to pay for gaps with prescription drugs. Do people know about it? And then finally, we have federal Rural Health Transformation Act funds. And just paying attention, how are we using those funds in New Hampshire? How is that growing the rest of the state? So just a few things as we look at policy going forward. Just wanted to focus a little bit on where can we start and where may we get some traction and where might there be some great need. So what I wanted to do with this presentation, what I thought is, we have limited time and I'll talk fast. But what you have here are a lot of resources with links so that if you wanted to know more, if you wanted to get data on the ground, these slides and the links are going to give you that. So I thought it would be worthwhile just to walk through some of these links. So first, when I think about policy, and I think about policy that's most confusing to folks, like who haven't been in it as part of their profession, often what the hard part is understanding the acronyms of public benefit programs. So what I did is toss in a link from the National Justice and Aging Program that goes through a number of public benefit programs and does a good job in explaining what do these programs do. So that may be helpful. I wanted to add in, we've talked about the New Hampshire System of Care for Healthy Aging and wanted to make sure you had a link to that DHS webpage. You can get the statute, you can get the reports to the legislative body that's been submitted annually, and also PowerPoint presentations from the department that break that down. The other wonderful resource is from the New Hampshire Commission on Aging. And you can take a peek at their general website, but what I wanted to highlight is that this group annually, it does an annual report to the legislature and the governor. And in that report, what they do is highlight need, but they also make recommendations going forward. So the Commission on Aging is just a strong partner in getting information out and really a reliable source for looking at what needs are in New Hampshire. So just wanted to highlight that group's annual report. When we're looking at the Commission on Aging, I also wanted to say, besides the annual report, what they've done is an initiative to promote a multi-sector plan on aging. Can we have New Hampshire have a 10-year roadmap for aging? And what they've done to start that dialogue is an Age Well community engagement report where there was significant feedback from the community. So here's a link where you can see what does that feedback look like? What are New Hampshire older adults thinking? I included the link to the Elder Index tool if you want to have fun with that and find out what it's going to take to live in your community. You can plug in your county and your state and take that test. Finally, not finally, this is one next. There's this beautiful report that came out in 2025, and this is from UMass Boston. And they do a lot of gathering of data. But what they did is New Hampshire, and it's a healthy aging data report, which if you love facts, figures, maps, finding out about a county, finding out about a community, this report, link below, will give you a lot of data points and really some look into disease profiles, caregiver profiles, isolation profiles. So it's a really wonderful tool for policymakers. We've talked about the Commission on Aging Transportation Needs Assessment that was just out this month. And I also wanted to toss in AARP, really looking at an economy built on folks 50 and older. A link to slides that were put out by New Hampshire Fiscal Policy Institute. And these slides really talk about and have information on the aging population and economics. And finally, just a link to the healthcare workforce, Health Force New Hampshire, so that you have that as a tool for, if you want to study and you want to learn, you've got all the tools possible. So there we have it for my slides, and what I'll stop sharing and turn this over to Mike.
Thanks, Judith. Let me just pull up mine. Okay. Wonderful. Well, good afternoon, everyone. And first off, I just really want to thank Zach and his team for organizing this opportunity. I think this is such a great way to be able to meet all of you, who are running for office. And at the end of this presentation, I'll be sharing my email. And so please feel free to send me an email with any of your thoughts or questions or comments. And then Judith, I think that was perfect as far as, just kind of giving us a really great baseline of, how, both, New Futures, but, we have really tried to work, not just collaboratively with New Futures, but also the New Hampshire Commission on Aging and so many other organizations in the state for how we can tackle some of these issues that we know are most impacting New Hampshire's older adults. One of those issues that we work on and is a huge priority for us is how we can support family caregivers. That's something we've worked on in the past and
Hey,
we'll continue to
Mike,
have.
sorry,
Yes.
sorry to interrupt. You're not sharing yet if you were intending to.
Oh,
So I just wanted to
perfect.
make sure.
No, that is a good note. I pulled the presentation up, but I didn't do share my screen. So let's go ahead and do that.
That was my one main role, is to make sure that.
Perfect. No, well, you
Yep,
did a great job.
good to go. Good to go.
Excellent. Okay, now we're ready to go, guys. However, for today's session, what I really want to focus on is talking about fraud prevention. One of the other issues that we really focus on here in New Hampshire, and then talk more specifically about an effort that we worked on this year revolving around scams involving crypto ATMs. So first off, one of our just main issues that we focus on and we prioritize working on is fraud prevention. We have about 150 volunteers here in New Hampshire, and I think just about every single one of them has been targeted, by a scam in the last few years. And I'm sure many of you, have been targeted or know someone who has been targeted. And so it's one of the reasons why we focus on this, is because it's just such a prevalent issue, and it's also constantly evolving. There really isn't a finish line with this issue. Maybe you could say that about a lot of the different issues that we work on. There's never maybe a finish line. We're always continuing to work on this stuff. But when it comes to fraud prevention and scams, they tend to be very trendy, where we'll see, in certain years, certain scams are more common. And we have absolutely seen in the last 5 or 6 years, scams involving crypto ATMs has been very, very common, not just here in New Hampshire, but across the country. So let's go next one. So, as I just mentioned, this is really a national issue, and it certainly has been very prevalent here in New Hampshire. But as you can see, really over the last 5 to 6 years, scams involving crypto ATMs has really skyrocketed. I mentioned that scams tend to be trendy, and I think what I mean by that is that when criminals identify an effective way to steal money from people or effective vehicles to steal money from people, they tend to continue to focus on that and really try to, squeeze as much as they possibly can out of that until states or the federal government puts protections in place for these things. And so, when we have seen this, you can see the figures here on the screen. But the other piece of this is that overwhelmingly we've seen this from information that we've gotten from the New Hampshire Department of Justice, but also, working with our local police departments, that these scams are overwhelmingly targeted at older adults. So what I want to do is talk a little bit about just kind of how these scams work and just give you a sense of this. First off, what do these things even look like? Like, what is a crypto ATM or crypto kiosk? They look very similar to a regular ATM. The structure that you'll see them in convenience stores, you'll see them in gas stations, you'll see them in grocery stores. Smoke shops is an incredibly popular place for them. And so what happens effectively is you will get a call from a criminal. Sometimes it's actually perhaps even a link that someone is told to click on. They click on it and then they have them call a certain place. And what it is it's someone typically impersonating government, police, bank, tech support. And what they do is they really focus on telling them that there is money at risk. There's something at risk. We've heard your bank account is compromised. It could be that someone that you love is compromised. Perhaps a niece, a nephew, a granddaughter is in custody, and the only way to get them out, or the only way to protect your bank account, is to then go and what they do is they will have you on the phone the entire time. that is a very key part of this, is that the scammer, the criminal will stay with this person on the phone the entire time. They will tell them which crypto ATM to go to. They will be at them when they sit down or when they're at the crypto ATM. They will instruct them to ignore a lot of the different things that might pop up on the screen. If one of the convenience store clerks walks over, to them while they're inserting cash into this machine and says, "Hey, I think that you might be getting scammed. Like maybe you shouldn't be doing that." The person on the phone will instruct them, "Please ignore that person. They are, don't have your best interests at heart." And so they continue to just perpetuate this scam the entire time through. And it can take, about an hour. It's not also something that it can take, several minutes. It can take longer than that. But it's something that very large sums of cash. We're talking, what we've generally heard is, tens of thousands of dollars is a pretty common amount, and it can be done very quickly. And then I think the other aspect of this is that, in talking with our folks in law enforcement, is that it's incredibly difficult for them to recover this money after once it is gone. And that is a little different compared to some other types of scams that are out there, where there are some more protections. There's a little bit more infrastructure in place, whether it's gift cards or it's wire transfers or things like that. There's a little bit of a higher likelihood that law enforcement can recover funds in those situations. In just about every single example where we've talked with law enforcement about this, they are not able to recover these funds. So New Hampshire was a target, and you could say still is a target. And I'll get to the legislation that we passed shortly that goes into effect in December. But New Hampshire absolutely was a target for these scams. Part of that is that we lacked any type of local protections. Inherently, crypto ATMs are not subject to many of the other safeguards that regular bank ATMs are subject to, or other. I brought up wire transfers, different things like that. There's effectively no protections in place or infrastructure around these machines. And so these machines have become a very popular vehicle for criminals to utilize. And a big part of that is that there are no transaction limits. And so, we again heard examples of people being scammed out of tens of thousands of dollars in one single transaction. And so one of the key things that we really focused on in our legislation was establishing a transaction limit. And I'll get to how that kind of impacts and what other states, how other states have seen that impact these scams shortly. And then, the other piece of this is that there were over 20 states at the time when we started this campaign at the beginning of 2026. There were over 20 states that had established protections around these crypto ATMs. Maine and Vermont specifically, and then Connecticut and Rhode Island, but our neighbors in Maine and Vermont had established protections. And so it just made us even more of a target when it came to these types of scams. And then, and again, talking with our local law enforcement, they saw so many of these examples across the state. Let me go to the next slide. So, one of the things that contributed to this is just having so many of these machines here in New Hampshire. It's hard to pinpoint the exact number, but we're pretty sure there's at least over 250 of them, but there might be many more than that. And then, I mentioned that we were working with a lot of local police departments to kind of hear, what they were seeing on the ground when it came to this, and specifically in Hampton and Manchester. They were two highly targeted areas where there are a number of crypto ATMs in a small radius in those areas. You can see the numbers, at least from what Hampton has reported. But there were so many of these cases. We're talking about thousands of these cases over the course of really the last 5 to 6 years. So moving on to the legislation that we worked on. So it was Senate Bill 482. We worked closely with the New Hampshire Association of Chiefs of Police on this legislation. We worked with New Futures on this legislation, and a number of other organizations. This was passed unanimously in the Senate, and then we passed it with an overwhelmingly bipartisan vote on the House floor as well. And I think what I would say about this is that this was really just common sense legislation. I think that many of our lawmakers really saw this as just very common sense. There is a very distinct problem that was being demonstrated, that we were able to demonstrate here happening in New Hampshire. And there were some pretty easy and common sense things that we could do that would really curb this from happening moving forward. And so the first thing is that daily transaction limit. That is so key. So many of the states that have passed legislation, the transaction limit was really crucial. And so limiting it to $2,000 per day, we can talk about the specifics of the numbers and all that, and it being higher or lower, all of that. But $2,000 per day was something that looking at kind of the landscape across the country, we had seen evidence that having something like this, whether it's $1,000 or $2,000 per day, was really having an impact in preventing these scams moving forward. And I'll kind of get to part of that reason on the next slide. But effectively, it's sort of common sense. If you have a criminal that is looking to extract as much money as possible in a short amount of time as possible, you're going to focus on the states that have either the highest limits or no limits at all. And that's why we were targeted, because we had no limits in place. And so $2,000 per day really disincentivizes criminals from targeting a state like New Hampshire, where we have that limit in place, because there are still a number of other states in the country that have no limits or have higher limits in place for crypto ATMs. A number of other things, so requiring fraud screening prompts, requiring stronger oversight of these crypto ATM operators. And then a couple of key things. What this bill also requires is that the first transaction that someone makes is held for 48 hours. And so that means that the money doesn't go anywhere. The transaction is literally held, and it can be canceled and refunded at the entire amount in that 48 hours. But even after that 48 hours, what this law requires is that within 14 days, if someone reports that they believe this was a scam, they report it to law enforcement, they report it to the crypto ATM operator, they will be refunded in full for that transaction. And so this was a huge step. And what it does is it doesn't go into effect immediately. It'll go into effect in December of this year. And then we'll really, get a sense of, how this law is impacting these scams. And what has happened since then? So actually now 35 states have enacted laws or regulations governing crypto ATMs. I mentioned a few of the states surrounding us. Massachusetts is working on a bill right now. And another important part of this is that 5 states have actually just banned these machines entirely. And I think what's also important to note about this is that of these 35 states and those 5 states, for example, that have banned these machines, there is no partisan divide here. These are blue states, these are red states. They are all looking at this from sort of the same lens, that this is just a huge problem and there is a solution to it. And so we really just need to prevent these from happening. And then really my last slide here is just talking about just why this matters. I talked about this. The bill, it really disincentivizes criminals from targeting New Hampshire. It reduces their ability to move those large sums quickly. If they can only do 2,000 at a time or really at a day, they're going to focus in other places. And so this was huge. And I know that many of our lawmakers that are on this this meeting right here were really crucial in us passing this. And so I thank you all for doing that, and certainly for everyone else. We'll, as I mentioned, one of the things we really focus on is fraud prevention. We try to work on something fraud related every year because it is so prevalent and really relevant to all of the folks that we serve here in New Hampshire. And so with that, that's the end of my presentation. I've got my email here for folks. Maybe I'll leave that up for just a second in case folks want to copy it down. And then Zach, I'm sure can share our contact afterwards with folks. But yeah, I appreciate you all, joining us for this.
Awesome. Thank you so much, Judith and Mike. So Mike, if you stop sharing, what I'm going to do is pin the two of you up in front of everyone. And I know we got, I think, like 20 or more questions submitted ahead of time. A few more have come in the chat. So 2 logistical points, and then I'm going to kick over to Mike and Judith to kind of go through some of the questions that folks have sent in ahead of time. This is being recorded. We will be sending out the full recording and the slide decks and links to all of that on the landing page with the other places to register for the webinar. So all the materials will be there. We'll make sure that Mike and Judith's contact information is there, all of that. So if any follow-up So I'm going to just throw one question from the chat to you, Mike, and then I know you guys are going to jump into some of the ones that were submitted ahead of time. So specifically about the crypto ATMs is if they look the same as regular ones, what distinguishes them? And then a follow-up to that is what like different purpose do the crypto ATMs actually serve?
Yeah, really good question. So do they look the same? They look a little different, you could say. You could say kind of the structure of them is very similar. They're kind of a machine that's maybe about the same height as a regular bank ATM. What distinguishes them as crypto ATMs? So in a regular ATM, bank ATM, you're transacting US dollars with those. In a crypto ATM, you are transacting cryptocurrency. So you're transacting either for specifically Bitcoin or another type of cryptocurrency, and you are feeding cash. It is a you could say that it's a trade where you are transacting US dollars. You're putting cash literally into the machine. There is no card. You can't use like a credit card or a bank card or anything like that. It is literally cash into the machine, and then you are effectively transacting it. You're trading it for cryptocurrency. And again, it could be Bitcoin, it could be another type of cryptocurrency, perhaps depending on the machine. And yeah, that is perfect. Wow. Yeah, someone just put that, Phoebe just put that into the chat. So that is a really great example. They look generally about the same, but they obviously do look different. It's kind of just like a touch screen that you'll work with. And I just want to get to, so what is the legitimate purpose that they serve? So, this is something that, this was part of the debate, in the last legislative session. There were folks that talked about how, this is one of the ways that folks would want to transact and buy cryptocurrency. And I think one of the things that we tried to illuminate through that is that there are a few different ways right now that you can purchase or trade US dollars for cryptocurrency. And one of the most common ways to do that is utilizing your phone. There is an app called Coinbase that is probably the most common app that is used to trade for cryptocurrency. And the transaction fee for making those transactions, for making those trades, is usually somewhere between about 1% and 3%. The crypto ATMs, vice versa, when you make these trades, when you put those US dollars in for trading for again Bitcoin or whatever it might be, typically the transaction fee for that is somewhere between 10, 20 and 30% even we've seen on the high end. And so it did call into question a bit. I think that there were a number of folks, and I think we do as well, that and I think one of the things we saw, I think, from law enforcement and even anecdotally from some of the convenience store owners saying, that they weren't really seeing a lot of legitimate transactions, especially these high dollar transactions. Most of the high dollar transactions they were seeing at these machines were typically fraud related. And so, I won't necessarily get into if there are people that are using these things legitimately. By all means, that is your choice, and we're not here to say otherwise. But I think what we were seeing was, and hearing from some different folks in law enforcement, and again from folks that have these machines in their stores, is that they were seeing a lot when they were seeing folks use these machines commonly. It was almost always utilized in fraudulent transactions.
So those were the ones that kind of popped up. So if you guys want to jump into some of the pre-questions, and then as more come up in the chat, I can weave them in there if you're not going to already be hitting on them.
Yeah, and maybe I'll just add, because I just saw another question just come in, just that was a little related to that, like who owns these machines? So there are several vendors. There are actually a number of vendors. I think there's actually about 9 vendors of these machines in New Hampshire. I'll let folks maybe do some Googling as to kind of some of the company names of them. But there are several of them. And then so the one thing I do want to clarify on is that the store owners, the convenience store owners, the gas station stations, whatever, they don't own the machines. They're not the ones that are actually like, say, getting a transaction fee. They're not selling they're not transacting the cryptocurrency. It's these vendors that own these machines. They are the ones that are effectively doing those transactions. They are the back end, and they would be the ones that are receiving the convenience store owners. They typically are just leasing space in their stores for these machines to be, but they are not the ones that actually own these machines and are actually executing the transactions at the machines, if that makes sense.
So I thought I would jump in because one question we got is, what is the number one challenge you're seeing? And I thought about that, and then what I thought would be important to talk about with that is the problems are all related like this. And so I give an example of transportation, and as the Commission on Aging really puts out in their report, not having transportation impacts healthcare. It impacts finding housing. So as I looked at that question, be hard pressed to say which one, but I thought that it might be helpful if I were to say three. It would probably be absolutely transportation. It would be funding the system care for healthy aging. And then third would be, how do we get those cost-effective services that keep people in the community front and center for more funding in New Hampshire? So thought I can't break that down totally or decide on one, but I think that was the best I could do with that question.
And perhaps what I'll just add quickly on that, thinking about kind of what, from AARP's perspective, what our number one challenge is. I think one of the things I'll mention is kind of to go back to what I talked about with caregiving. I think that is something that our organization has really prioritized across the country, whether it's working in with our state lawmakers or at the federal level, is figuring out how are we able to demonstrate this issue for our lawmakers, and how one of the things that we think about is specifically with family caregivers. There are so many. I think our number says that there's about 281,000 caregivers here in New Hampshire, and so many of them are family caregivers. They're unpaid, right? They're folks that are just providing care for their loved ones in their homes, and I think part of this is keeping folks out of long-term care facilities for as long as possible, right? There's probably always a stage when someone needs to go to kind of that next level of care. But one of the things that we hear on a regular basis from our members, from the general public, from our volunteers, is that people want to age in their communities, as long as they possibly can. And caregiving is such a huge component of that, is making sure that there are resources available to caregivers that will allow them to continue to do that as much as possible. And so I think, and I know this is an issue that Judith, works on as well. And that's really one of our main focuses, is really trying to kind of connect that issue with policy options that will really help and support caregivers in New Hampshire.
Well, I'd also add about caregiving. We've had two pieces of legislation in the last years, one for additional caregiver respite. Can't tell you how beneficial it is to work in a coalition and have Mike there, and also the Alzheimer's Association, and then more recently training for caregivers. But what I would say also, if we're looking at policy and looking at what lawmakers appreciate, we had caregivers go in and tell their story. And that particular interview, the person who testified took over the room. And then it was clear to me that lawmakers need to see more of New Hampshire citizens who are doing the work. And once they see this, they become invested in supporting that work. The other program that really moved lawmakers was the senior volunteer programs, and letting lawmakers hear you have people in a structure ready to do that and ready in place for that. So as we look at policy, and sometimes we're looking at tough legislative years, it's really looking at what makes economic sense, what speaks to lawmakers, and what helps the community. And I think when you look at caregiver programs, volunteer programs, you're really winning on a lot of fronts.
And you know what? I've seen a few different questions pre-submitted and then just from the chat revolving around housing and even kind of intersecting with caregiving. And so one of the things maybe I'll talk a little bit about is, and I know it's not that the housing issue is not a silver bullet issue, and maybe you could say that about all the issues maybe that we work on. There's no silver bullet necessarily, but certainly the housing crisis that we're experiencing here in New Hampshire and around the country, there's no silver bullet, to kind of get there. One of the things that we've worked on as one of the ways to maybe add additional flexibility for folks to be able to have different housing options is around accessory dwelling units. I also know that's a little bit of a controversial issue as well. There are some other issues that kind of come in with local zoning and things like that when it comes to having ADUs in communities and not. And so I won't get into that piece. What I will just say is that what we've found from at least our perspective at AARP, and the reason why we've generally been supportive of folks being able to have accessory dwelling units on their property is because we've seen that from sort of a caregiving and an intergenerational living perspective be pretty effective for people to be able to stay in their communities, perhaps downsize. I think that's one of the things we've seen where, if someone is able to have an accessory dwelling unit, an in-law suite or something like that, on their property, it's in many cases a much better living situation for that person. It's a smaller, usually a smaller unit. It's many times on a first floor. There's no stairs, and I think what we've also seen is that to kind of go to that intergenerational living aspect of it, we've seen examples where perhaps the older person has moved into that unit, that ADU unit, and then their family has moved into maybe the larger space, and so they're able to not only just stay close to one another, but also really provide that caregiving aspect. And I think one of the questions I just saw around maintaining a home when someone is aging in place. We hear that all the time, right? And part of that is perhaps having a smaller unit and also being closer by to maybe those folks that are caring for that individual or helping to care. And so I think that is one of the things I think we've seen as far as being something that folks will do and have found being an effective way to provide additional housing, maybe downsize housing, but also be provided helpful in providing care to that individual as well.
And I'm happy to build on that, which is I always love to refer to our partners who have a lot of expertise in housing, which is New Hampshire Housing Action. But then also, as we move forward, we're doing a lot of research. And one thing that we'll be researching, there are other states that do this, is housing share programs. And that's done successfully in Vermont. And could there be a pilot program in New Hampshire? So it's a complex problem, but there are some rays of hope in there. So just thought I'd mention housing share is one thing that I know that we'll be researching and looking at.
All right, I think I'm going to jump in and wrap us up here. So really appreciate everyone being here. I'm going to throw a few things in the chat, so don't run quite yet. First off, just huge thank you to Judith and Mike, both for participating, but also for kicking us off with this series. So we do have a feedback form that will help us kind of make sure the feedback will be shared with Judith and Mike and everyone. So please fill this out. 1-minute feedback form helps us make this series, continue to improve on it. We're going for the next 5 weeks. The topics are ranging pretty much every possible topic, policy topic that is hot in New Hampshire, and we hope lawmakers, candidates, and the general public are interested in. You can register for all of them on the landing page there. We will be sending out the recording, the slide deck, contact information for everyone. The hope here is that people can get to connect with folks that are clearly experts in their fields and their organizations, and really kind of get to learn from them and work with all of us in whatever space you're in as an elected official, member of the public, caregiver, anything in between. So really hope that you all give the feedback, please. Register for future ones, provide questions in there. And yeah, really appreciate everyone taking the lunch hour with us. And thanks again to Mike and Judith for kicking us off on this candid webinar series this year. So hope you all have a good day and be in touch.